at, the end of session, that turned out to be fairly good news for everyone, right? We didn't see some of the cuts that we were expecting to see, and I'm talking self-sufficiency in particular. We ended up with an investment in some of our refugee work, and that was nice. We know how great the needs are there, and a few other things in terms of our one system staffing levels, so that we can keep benefits rolling and things like that. So that's in the rear view. But what that means is that we are headed towards the new budget creation and new legislative concepts and policy option packages and whatnot. And I know Stephanie's going to talk a little bit more about that here in just a minute. What I am here to talk about today is just a light touch, to be candid, on the transformation work that's happening here in the agency. And I just have one slide I want to share because I think that it does a good job of setting the tone for basically what we're thinking and why. And can somebody just give me the heads up that you can see that? Yeah.
Yes.
Okay, great. The transformation really comes from years of hearing feedback from partners, from our clients and customers, from tribes, from staff about how ODHS could be better. And all of that feedback comes at us in any number of areas, topics, from how we set our offices up to how we deliver our benefits to culture, diversity, all of that. And we are now really, really close to implementing some of the ideas to try to improve how we are as an agency and how we work for you and how we work for families and how we work for individuals and special populations and all of that. And I one of the things, we've got our new director, Lisa Went, right? 3 months in or so, and maybe a little bit more, I guess, now. And she is really very clear in her leadership about what she says as obsessing over customer service. And that's an expression we're all sort of tossing around as we're doing our work and thinking about how we're doing our work. And what I would say is that we are using, a very broad definition of customer experience, those sorts of words are what we're talking about. And I, for example, consider you all my customer, SSP's customer, so I want to try to find ways to obsess over you and the needs that you have by opening, dialogue in any number of ways around this transformation. And I just thought I would share with you some of the ideas that are fundamentally at the foundation of the transformation, and then see if there's any feedback about any of that you'd like to share. And then mostly, I'm going to promise that there will be more information as we move towards implementation. Right now, we have some milestone meetings that need to happen about funding and some other things to determine exactly what the transformation will look like and when. But we are trying to reorganize to do some really important things. Key point number one, it does not change our mission at all, right? We're talking about redesigning how we do our work. We really want to be the place where nobody has to see our sausage making, so that you come in and you experience us in the most effective possible way. So to do that, we are transforming how we approach our administrative functions to reduce duplication, cumbersome processes. And that's not only for our customers in terms of external, but it's also internally, right? We want our subject matter experts to be able to do the work they do the best, whether it's family coaches or what have you. We want them to spend all their time doing that good work because they're good at it. They've been doing it a long time, and we don't want them to have to do unnecessary things. So that's a big part. We also heard loud and clear from everyone that they expected the ODHS agency to be able to be really accountable and have good escalation pathways. And I will tell you that as part of Liesel's lead up to her appointment, part of her listening tour was not just out in community, but it was also she met with all the legislators. Of course, talks with the governor regularly, and we heard about accountability really across every aspect. So there's a lot of structure around accountability that's going to be built into the new design. We're desperately trying to get better at aligning policy and practice. As a big agency like we are, oftentimes there's a little bit of sort of a telephone game problem, right? When a policy team makes some sort of a change, how it rolls out to the end user, whether that's staff or clients. Sometimes we miss the mark on that, or we have unintended consequences, and we're trying to develop new feedback loops and sort of a circular process for continuous improvement to try to make that alignment feel better to everyone. Again, I mentioned that we want to increase our frontline capacity, in particular around shifting administrative burden. And then ultimately, it's to align services around the whole family stability. And one of the things I think you have all heard a little bit about in a prior conversation was the idea that we want to create a continuum of services so that folks are able to be served in any way that they need seamlessly. And so we're aspiring to build that continuum. And in the end, it's complex systems that we have right now, turning them into processes that work better, just generally. And the exciting part for me, and we've been talking a lot internally about our why, is the idea that the entire agency, top to bottom, up and down, side to side, are all working on the very same emphasis about this doing better work for the customers that we have. And I love that. I mean, every room we're in, we're talking about that ultimate goal and what we can do individually from our chairs to make that happen. So this is really sort of the philosophy, the foundational principles behind it. As you can imagine, there's a lot of details, and there's going to be all kinds of, conversations that need to happen. But we hope, as folks who contract with us, folks who provide services for us, folks that we provide services to, I mean, we expect that everybody should be able to feel a positive outcome over time as we all try to focus together on this new vision for the way the agency operates. We'll have lots of opportunities for folks to weigh in as we move along. I hope you're feeling a difference already about how we communicate. Our comms team, oh my gosh, they're doing amazing work getting out information. I hope you feel that. Stephanie and Cheryl on their team are doing amazing work getting communications out and doing the best community engagement I think we've done in years. And that's part of a commitment to this work, just generally. And I think it's exciting. Be curious if anybody has any questions. I may not have all the details to share yet because we're just really beginning to get into a future implementation mode in the next few months. But I hope this resonates for you, at least. But I'd be curious maybe if it doesn't too.
It's actually looking back at your driving history. They just found you a check for a little.
All right. So I think we've got somebody who needs to mute there, if you can. Then the last thing I'll just share with you, and I think Stephanie's going to put up the details on this, but we do have a meeting a week from tomorrow to gather feedback on our 27-29 budget and our LCs and our POPs. And so I hope you all will be inspired by Stephanie's presentation and come join us for that. It's a couple of hours long, and we're really looking forward to having some open conversation about what are you thinking we should be doing. We're going to tell you what we think we should be doing. So more to come on that as the meeting unfolds here. And I am not watching the chat at all, James.
No, nothing in the chat. But does anyone have a question for Claire or clarification or anything? It's not a surprise that changes are afoot here, but sometimes it's difficult to understand how it may affect your work. And like she mentioned, we're hoping it doesn't. but that, the goals and the reality are sometimes a little different.
Well, I'm available anytime for anybody who wants to have a chat. So reach out to me. I am happy to share what I know, share what I think, point you in the right direction if I don't know. So don't hesitate. Thank you very much, everybody, for coming. Really appreciate you in our world for sure.
Thank you, Claire. That's our director for self-sufficiency. And the next item on the agenda, before we get Stephanie, that she alluded to a few times, is listed as Misty, but Misty could not join us. So we do have the Senior Advisor for Policy and Research and Legislative Affairs from the Office of Immigrant and Refugee Advancement. Oana Nguyen, I hope I pronounced your first name right. But are you here with us? Yes.
Sorry, I was managing multiple screens. Can everyone see my slides?
I can.
Okay, perfect. Wonderful. And good afternoon, and thank you so much for the opportunity to be here with you and share a little bit about our office. So as James noted, I am not Misty Shoney. Misty had a scheduling conflict and asked me to step in. Um, so I'm gonna roll with it here. So my name is An Nguyen, and I serve as the Senior Advisor for Policy, Research, and Legislative Affairs with the Office of Immigrant and Refugee Advancement. I've been in this role for just under 2 years. Before this, I've spent more than a decade working in the immigration space, including providing legal services to asylum seekers and urban refugees in Bangkok, and researching the experiences of migrant workers in Kuala Lumpur. Before joining OIRA, I worked at the legislature staffing the BIPOC caucus. I'm a second generation Amerasian. My family and I immigrated to East Portland in the early 1990s through the Homecoming Act, which created a pathway for children of U.S. servicemen who were left behind during the war in Vietnam. I grew up listening to my family's stories of forced migration and family separation while helping my family navigate what often felt like an unfeeling set of bureaucracies in a new country, sitting across from people who do not look like us and a language we do not speak. So it's these experiences that ground my work today. I understand the importance of state systems to immigrant and refugee families during their time of transition, but I also know that these systems must be responsive to the changing needs of communities. And this is what OIRA's focus is, helping Oregon build a coordinated, responsive system that doesn't just serve immigrant and refugees, but also works with them, shaping policies and programs in partnership. I want to start here because this is the heart of our work. There are more than 404,000 immigrants in Oregon. That is roughly 1 in 10 Oregonians. This includes more than 200,000 non-citizens, many of whom contribute daily to Oregon's economy, but face barriers to services or protections. Immigrants make up about 13% of our labor force, working in every sector from healthcare to education to agriculture and technology. And since 1975, more than 67 refugees have resettled in Oregon. These are people who have rebuilt their lives here and are part of the fabric of our communities. So when we talk about immigrant and refugee advancement, we're really talking about Oregon's shared future, how we ensure every person who calls the state home can thrive and belong. I want to spend some time here because this slide and what follows really explains how we've approached this work from the beginning of the founding of our office. OIRA was created by the legislature in 2021 with a clear purpose: to ensure that immigrant and refugee communities are centered in Oregon's system and not treated as an afterthought. The intent was statewide coordination, accountability, and belonging for communities that often interact with multiple systems at once. That purpose has always been clear. What had been missing until now was a shared strategic framework for how the office carries that purpose forward over time. When our new director, Jessica Ventura, joined in July, one of her first priorities was developing a strategic plan for this office. Not because it was overdue paperwork, but because the environment demanded clarity. Federal policy shifts, increased enforcement activity, and growing uncertainty were already putting pressures on immigrant and refugee communities and on that system that serves them. Without a clear path, that risk was becoming the risk was that we were becoming reactive rather than intentional in how we carry out our work. Our role is to serve as a bridge across state systems, including ODHS, OHA, and others. We coordinate policy, research, and communication, and we translate what we hear from community partners into actionable guidance that helps state systems respond with clarity instead of confusion. Over the past few months, we have intentionally created space to hear directly from community partners across the state. We ask what is working, what is not working, and where systems feel confusing or misaligned. We listen to how national changes are showing up locally and where state processes are helping families or hindering families. What we heard consistently was a need for clearer coordination, more predictable state system behavior, and better alignment across agencies. Partners want to know who to contact, when engagement is most effective, and what to do and what to expect from state systems, especially during periods of instability. We recently completed our strategic plan, and this slide reflects the areas that surface most consistently across interviews, focus groups, listening sessions, and surveys. What's important to say up front is that these are not programs that our office runs, and they are not a checklist of commitments. These are issue areas where partners told us the pressure is highest and where gaps in coordination or clarity are most visible right now. Two areas rose to the level of critical priorities. The first is nutrition and food security. Partners have shared that changes in federal policy, eligibility rules, and administrative processes are showing up quickly in households. Families are making trade-offs, delaying care, and relying more heavily on community-based supports. The need here is not just resources, but clarity and coordination across systems. The second critical priority is access to immigration legal services. Partner describes legal services as a gateway to issues, as the gateway issue when people can't access timely, accurate legal support. Instability compounds across housing, employment, education, and health. This consistently came up as an area where lack of coordination creates downstream impacts. This prioritization really helps us to be honest about our scope. Our office cannot lead on everything. Our role is to focus where coordination, policy guidance, and system alignment makes the greatest difference, and to work in partnership with other agencies and community organizations to hold programmatic responsibility. And these findings informed how we structured our plan and how we intend to focus on our capacity over the next 2 years. What we're seeing nationally is not a single policy change. It's a coordinated set of shifts reshaping the immigration system. Enforcement is expanding. Legal pathways are narrowing. Institutions that once focused on processing benefits are now being redirected towards immigration enforcement. HR 1 accelerates these shifts by dramatically increasing federal immigration enforcement funding. While enforcement activity has already increased, these resources have not been fully deployed. And once they are, states like Oregon should expect immigration enforcement activities to intensify over the coming years. At the same time, access to refugee resettlement, asylum, humanitarian parole, TPS, and even naturalization is being restricted. New and increased fees make legal pathways harder to access, while delays and instability in immigration courts grow. Federal changes also limit immigrants' ability to work legally and access basic supports like health coverage and food assistance. This pushes families into instability and shifts costs and crisis response to states and community organizations. For Oregon, this shows up in increased pressure on local agencies, schools, clinics, community-based organizations. Families change routines, workers withdraw from public spaces, and children carry stress that reaches far beyond the moment of enforcement. For mixed status families, this uncertainty has been particularly difficult. People are unsure whether it's safe to reapply or whether seeking help could jeopardize their status. HR 1 has restricted eligibility for key benefits like SNAP and Medicaid to a smaller set of immigration categories. It also provided the government with an unprecedented $170 billion to carry out its immigration policies. OIRA's role here is to track these federal changes, convene partners, and help Oregon systems respond in a coordinated way rather than in isolation. A key part of this coordination work is leading the Interagency Council for Immigrant and Refugee Coordination, which was established by Governor Kotek through Executive Order 2604. The purpose of this council is to help coordinate state agency responses when immigration enforcement impacts begin to surface across system. The council brings together directors or designees from major agencies whose systems are most likely to experience those impacts. That includes agencies like ODHS, OHA, OED, OHCS, DELC, HEC, ODOT, and others, along with representation from the governor's office. The goal is not to centralize authority or dictate how agencies operate day to day. Each agency continues to run its own programs. The purpose of the council is to make sure agencies are aligned when issues arise, so responses are coordinated rather than happening in isolation. The structure helps create predictability so that when issues arise, agencies are not trying to figure out coordination in the middle of a crisis. Another important arm of OIRA's work is our policy and legislative work. We regularly engage with legislators and staff to share technical information about how immigration-related issues show up across Oregon systems. During the short session, this also included conducting legislative huddles to help community partners understand what's happening, what's moving, where and how proposals might interact with state systems. This slide summarizes key legislation and budget investments from the 2026 legislative session that affect immigrant and refugee communities in Oregon. These policies touch multiple systems, including education, professional licensing, legal representation, and refugee resettlement services. These measures expand OIRA's statewide coordination role across education, public safety policies, and professional licensing systems. OIRA does not administer any of the funds noted here. However, our office tracks these types of investments because they affect the broader ecosystem of immigrant and refugee services across the state. Before we wrap up, I want to leave you with a few ways that each of us can support immigrant and refugee communities during this difficult moment. Whether you work in state government, a community organization, business, or simply as a neighbor, we all play a role in creating a sense of safety and belonging. Sharing accurate information is one of the most powerful ways we have, one of the most powerful tools that we have. When people know their rights, know who to call, and feel seen in the process, it builds trust. And that's how belonging moves from being an idea to something that people experience day to day. We're committed to keeping our partners informed as our work evolves. We share updates through our monthly newsletter, our website, and regular open houses. We also continue providing direct briefings to key partners to make sure information about our initiatives, community engagement, and strategic planning is easily accessible. We want this work to feel connected and not siloed, so everyone working to serve Oregon's immigrant refugee communities has a clear line of communication with us. We have also created some resources sheets that you can access on our website, and which we can also share in a follow-up email with James. And that is all I have. Thank you so much for having me today. This is Misty's contact, but I can also put my email into the chat in a little bit. Thank you so much.
Thank you, Ona. And I know we have several groups that do significant work with immigrants and refugees. Does anyone have a comment that they want to share, or maybe some work they've done? I know didn't warn you ahead of time be asking that, but you can see that there's a lot of work that the Immigrant and Refugee Advancement Office is doing, but Just wondering if anyone had any questions about their work or wanted to share some of their own. Okay, that felt like a couple seconds I let by there. All right. No one wants to take a moment to brag about their work? I know these are difficult times and not meaning to make light of it, but I want to thank Ms. Sion and all their teams for the work they're doing and all of you who are doing this work. But I'm going to go on then to the next time on the agendas. Stephanie, are you ready to go?
I am. Can you hear me?
Yes.
Sometimes with Zoom, I don't know, my computer does strange things. Yeah, I just want to say thank you to Dr. Wynn and the team at the Office of Immigrant and Refugee Advancement. I'm so happy that that office exists, particularly now. I think it's absolutely crucial, the work you're doing, and just really appreciate you. Okay, now we're going to talk about the budget. We are here. Some of you maybe joined us earlier this year in January during the Together We Plan sessions, which was really just a primer on the agency request budget process. If you missed any of those, I am putting in the chat where you can find the slide deck and the recording, and also a summary of what we heard. We were then just sort of getting basic ideas about kind of where policy and real life is impacting your communities, what you're hearing on the ground. And now we're really moving into the next phase of development of the budget. And you can go to the next slide. So today we're going to share where we are in the budget process, and explain kind of the fiscal environment we're navigating, because it's becoming a little clearer, although we'll never know how much money we have until the very end of the next legislative session. The current phase we're in of ARB, which is Agency Request Budget Development. And then Claire talked about how on March 20th, which is next Friday, SSP is going to host a 2-hour-long virtual session to discuss how SSP might shape its priorities within the limited resources that we're going to have probably, and really invite a focused conversation with you around things like what has to be protected in this environment, where shifts in funding might create a really big or negative impact, what principles should guide these difficult choices. So we're not going to be asking people to choose between programs or anything. We're just wanting insight, so that can help us shape priorities. And for tribal nations who may be on the call, I just want to reaffirm that formal government to government consultation is continuing through the established processes. It's led by the Office of Tribal Affairs, and the Dear Tribal Leader letters went out at the very beginning of March. So we're waiting to hear on that. We also will be at the tribal directors meeting at the end of the month at Warm Springs. So just wanted to make sure you knew that. Next slide. Okay, we have been hearing some things. This is sort of a summary of themes that we heard from partners around SSP at the Together We Plan events and at the survey we gave last October. So we just want to reflect back what we heard. Really, folks wanted mostly protection of what exists now. And then, reducing timelines about determinations on eligibility, too much administration, those kinds of things, centering equity and access to benefits, especially around rural and culturally specific communities. So folks were not asking for big changes. They really wanted protection of what was happening now. We also heard deep concern and uncertainty about the future. Did I miss the email invitation for that meeting on 3/20? Could somebody please post how to sign up? Yes, we will do that now and at the end of the meeting as well. And I'll have folks from SSP talk about that. But wanted to hear that many folks described how instability, whether it was funding, policy changes, food insecurity, immigration enforcement, which we just heard about, or sort of those broader economic pressures, was affecting families and providers. And that uncertainty really made planning and sustaining services more difficult. We also heard that impacts are not evenly distributed. Some people are being impacted more than others, that our systems are hard to navigate. And we heard that communication clearly matters. So we're really trying to be transparent about the information we do have, what's happening, and why. And that engagement should lead to action. So we want to know, as we're engaging folks with the ARB, that what you said, we can clearly showed up in the budget, or we say why we can't, right? Okay, next. There's a Zoom link in the chat. So next slide. This is our fiscal reality. As we move forth closer into the budget process, the fiscal environment is becoming clearer. State revenue growth for this coming 2-year cycle is looking pretty limited. And we at ODHS are not expecting any new significant general funding for program expansion. And at the same time, everything goes up from year to year. So revenue is not increasing, costs are, caseloads are. And so that means we're entering a really constrained fiscal environment. We also know that HR1 has a lot of regulation that has to be met. Luckily, we got a bunch of positions at a short session that will help with that. And there are state requirements that have to be met. We have really old technology, I mean, decades old, that can't actually continue to be deferred. We have to deal with it. And we have to prioritize what we're going to do. Next slide. This is just a general reminder for those who missed it that budget development in Oregon, that 2-year budget or biennial budget, happens in 3 phases. The agency request budget, which is what ODHS is working on, and we submit that to the governor. That's due in September. We are trying to get a bunch of input as we can. We'll also have input from ongoing policy work groups or conversations that have been going on for a while in ODHS. We're not starting from the beginning. Then the governor produces a budget by the end of December or February if it's a new governor, because we're in an election cycle. And once that happens, that's our budget. ODHS has to follow the governor. So that's kind of the limit of our advocacy there. And then once legislative session starts, which is the beginning of January through end of June 2027, there's a lot of public hearings on bills, and the budget bills also passed. So it's the legislature that decides everything. So we're really kind of a few months into the number 1 there, the ARB. So now is our time to really have an impact on what goes into that for consideration by the governor. Next slide. I can't emphasize this enough. A lot of times folks, our partners or community members will tell us things that they want changed, a policy or more money for this or that, or any kind of change, and expect us to carry it to the legislature or to make it happen. But our role in the budget process is pretty limited. And it happens now. It's really at that agency request budget point. During legislative session, which is when the decisions around the budget are made, we can provide sort of nonpartisan, factual information about the budget. How, if you do this, it'll impact us this way, but we can't advocate for or against legislation unless the governor said so, right? Or unless it's in the governor's budget. The advocacy positions for us are set by the governor. That's why it's really important that partners share their own advocacy positions directly with legislators, because we can't carry the message for you unless it's sort of in that narrow way. Next slide. All right. So right now we have a bunch of folks in our budget office who are working on the basics. where we begin, which is like, okay, so we had last time's budget. We take a look at that. What adjustments were made during this last legislative session? What program funding is ongoing? What positions are not? And then they add to it an analysis on what it's going to need to continue doing just what we're doing right now. Because we know caseloads change, they're going up. Inflation and provider rates go up or change. Some things we don't do anymore and other things we do. Some things are mandated by policy. Sometimes we have, for example, labor collective bargaining agreements, which say, okay, this cost is this much. So that's where we start, is the base budget, and then adding what it would take to just do what we do right now. Next slide. And that happens internally. The agency request budget, though, also includes two things that are extremely important that we want to get your perspectives on at that March 20th meeting. The first one is policy options packages, or POPs. That's how ODHS or any state agency decides to do anything or gets permission to do anything new or different. So those can be additions of funding and policy. They could be reductions, but it's anything new, because we can't decide to do anything without the legislature approving it. So we've been told that they must be budget neutral this year as well. We also are required to do budget reduction options. Next slide. Okay. We've been told that our policy options packages this time have to meet several, they must align with, on the left side there, you'll see the governor's strategic priorities, which I'll show you on the next slide, the agency's mission and vision, leadership's guiding principles, and on the right side, you'll see what we're allowed to do. I'm going to go ahead and fly through this slide. It's a little technical. So we can get more into the weeds on the 20th. But on the next slide, you'll see the governor's priorities. The governor has said, you know, I'd like to see ideas and my budget will align with these things. And they really are in 5 buckets. The first one is economic development. So ideas that are around job creation, business growth, funding, taxation. Executive orders. You heard one executive order that was just mentioned by Dr. Nguyen about coordination of immigrant serving organizations across Oregon, but also clean energy, housing, behavioral health, earthquake preparedness, sort of the executive orders that have come out of the governor's office. Affordability, and you can see food is on there. So that definitely goes with SSP. Customer service and efficiency, which Claire says we're all supposed to be obsessing over right now. And protecting Oregon values, which the governor defines as civil rights protections, access to essential services, and preserving state authority. And so that's kind of the context that we're working our budget under, because really we're just one piece of the governor's overall budget. Next slide. Also, by law, we're required to, every 2 years, give a list of at least 10% in reductions. This happens in good years and bad years. It's not just years like this where we're in a constrained budget environment. And we definitely want to hear what should be protected and get feedback on those reductions from you and from our partners in the community, because you know, it's really important to do so. And they've told us they have to be realistic and achievable. We have to support them by data, show what's going to happen if we cost shift, those types of things. So that's part of this ARB process. Next slide. This sort of gets into the descriptions of what we have to do in the reductions. I won't go too much into detail. But we need to assess, like, okay, if you reduce this, what are the impacts to clients? How does that impact the workload? You know, a lot of times folks say, oh, just deal with administration. Well, those folks support the program. So what's the impact there? And what are the risks that not associated with the fiscal estimate, but just in general? Next slide. And this is my last slide for this brief presentation. And again, I was just trying to show you kind of where we are in the process of our budget. The save the date is there. The Zoom registration is in the chat. And I believe this deck will also be going out to you with notes. But we definitely, and this won't be the only opportunity. If you cannot make this meeting, Self-Sufficiency has a survey that you can fill out. And there will be other opportunities to engage. But if you can, it would be really helpful because we want to dig deep. And it's Friday, March 20th, 10 to 12. Really, these are the questions they're going to struggle with. So if you could begin thinking about how you might want to frame it, that'd be great. So like, what are the principles and values that should guide these difficult choices in developing the self-sufficiency program budget? What services and programs must be protected? Where do you see opportunities to improve? Maybe you, from your point of view, see efficiencies, duplication, better use of resources. I mean, take a look at what we're doing and give us some feedback there that might help. And then, are there ripple effects that self-sufficiency should understand? And by that, I mean, okay, if you cut X, it's going to have an impact on this population, right? So it's not just impacting self-sufficiency, it also might impact people with disabilities or elders. So those are some of the pieces that self-sufficiency is going to hope to hear from our partners through this meeting and also through the survey that will help them figure out how to prioritize. So it isn't just staff doing this alone. That's all I have. I feel like I've been talking for a long time.
I didn't think you could do those slides in just 15 minutes.
Woohoo! I actually practiced.
So
to see.
I hope that people who are interested are able to participate next week. Thank you, Stephanie, for all that information. And yeah, it's a process, and the budget is an important one. And I think, speaking for myself, I think the agency could do a lot better in getting our partners more incorporated, not only in our own budget process, but also help partners with the legislative process, which is where, you know, the money really does get decided. So, and obviously we're limited in what we can do, but we're happy to share factual information and help wherever we can. But we're reaching near the end of our meeting. I want to make one other plug on a meeting that I host. It's sort of an office hours. I'm going to just put some information in the chat about it. But next Wednesday at 2:00 is a quarterly sort of one office hours, and love if it's pretty informal. I control some policy and one systems experts to come along, and I give a very brief presentation, and then we open up just for questions, sort of like I'm hoping to do right now. David, what do you got?
Yeah, thanks so much, James, and thanks, Stephanie, for demystifying a process that is so rarely communicated to anyone. I know so many of us work with other parts of ODHS, other agencies. Is there where could we find how other programs or agencies are running similar processes?
Yes, actually, that is a really good question. So we were asked as the Community Engagement and Strategic Partnerships Office to help each program run its own engagement with, quote, key partners. We don't have a system for knowing who those partners are centrally across the whole agency, although we are working on a system as part of our technology and efficiency, but a CRM essentially. But what I have been doing is working individually with the program directors, and some of them are already going out to have events. Aging and People with Disabilities, APD, has already scheduled several that are upcoming. If you're not already on their list, please just let me know and I'll connect you, because there's no sunlight on what each part of the agency is doing. We're working on that, but everything has been siloed and we're trying to unsilo it. The VR, so vocational rehab, is having their event, I believe, on the 18th of March. ODDS, the Office of Development Disability Services, they are scheduling one on the 23rd of March. And they also are going to be doing a lot of engagement this summer, late spring, early summer, because they have a new director. Who else am I missing? There are a lot. And there are also 3 events scheduled the first week in April just for staff to also engage in our staff, our union leadership. We're trying as much as we can to get out in front of people. So just let us know if you want to be connected to other parts of the agency. Similar questions, right, around principles, values, what has to be protective, how could we improve, what are the different ripple effects will happen in these different, and child welfare has several dates too. So I will connect you if you're not already on their lists.
David, were you wondering about separate agencies or within ODHS too?
Both questions, but I understand you all don't run in the entire ODHS or coordinate multiple agencies. So I appreciate what you shared, Stephanie, and
Sure.
I'll reach
I mean,
out.
I will tell you, like, we were directed very early on by our new director, Liesl Wendt, to do a much better job engaging community and partners around agency request budget. That does not happen in other parts of Oregon's agencies. I have not seen anything come out so far from Oregon Health Authority, Oregon Education Department. I don't know what they're doing. Do you know, James?
I mean, I think it varies from agency to agency. It's hard to, it's such a big, there's 11,000 employees here at ODHS, but there's 40-some thousand around the state. And so like housing, I know, has a different relationship with their advocates and employment department and so, yeah, it's just different.
Yeah, I mean, we're trying as best we can. It's also one of those processes that's extremely technical and wonky, right? Especially when you think that 65% of the funds that ODHS receives are federal, and even the state funds, sometimes those are just match for federal funds. So the amount of funding, general fund, Oregon money that we're talking about being able to play with is just much smaller, right? But there are things that we can do. Also, legislative concepts, some of them don't have to have revenue attached, like things that we do that might have served our purpose long ago, maybe we shouldn't do anymore. And so we're looking for your perspective.
And Beth, I know APD has monthly calls with their partners too, but this is, I suppose, talking about the budget is a separate system. Yeah.
Yes, and I can send you, they're having several partner meetings specifically around the ARB. So I can send you those notices. We are trying to get better about showing up as one ODHS, but there are some silo issues that we are addressing.
Well, we're near the end, but any other questions or comments? Relatively quiet bunch today, but we appreciate your work and feel free to drop us a line. And
that was me. I didn't mean to clap, but I'm clapping. I just had my hand up.
oh,
But
Did did you want to put your hand up?
yes, but
Well, then go right ahead.
but I'm also clapping for a great presentation. This is Colleen Bradford, a community partnership coordinator who in the Marion Polk and Yamhill and concentrate a lot on the Santiam Canyon area. And I work with not so much. I work with we of course the internal contracted partners, but mostly with our external partners. A lot of external partners that we share individuals and families with. And I just want to say, James, and I know a lot of other people did that. You sent out the PowerPoint, updated PowerPoint for March for community partners and some other information. And I really felt this PowerPoint, not that the other ones weren't great, but this PowerPoint was so full of knowledge and very transparent, and especially with the Medicaid changes. And that's what I felt that the ABOD communication I wish could have been like that. And
Colleen, you're opening a big can here of interesting stuff, and
sorry. Well,
not everyone here has seen that latest one. We hope to get it out to everyone shortly, and then you also bring up a big issue that I think we're going to be addressing in future meetings about the work requirements that are coming for Medicaid. 2027 are similar but slightly different than the ones that SNAP already has. So,
I apologize because it said for community partners. So
yeah. And I hope you do share it. I gave a frazzled presentation on the earlier deck last month, and so I hope everyone and we sent out a copy. There's a new version that we'll have to be getting out. So, but yeah, Colleen, thank you for pointing all that out. And I think we're close to our time. Any other quick comments? Technically, we're over time, but thank you, everyone, for your work. And appreciate you coming here. And please drop us a line when you have questions. And I hope you know how to reach me, Catherine, or Stephanie, too. So thank you again.